Thyroid hormones are very important in pregnancy, both for the mother and the developing baby inside her womb. Now, hormone levels of the thyroid fluctuate throughout the pregnancy, and it is important to remember two facts. One, high or low thyroid hormones in the mother can affect both her and the newborn and the unborn child. It is important to remember two facts. First, fluctuating or abnormal thyroid hormones can affect both the mother and the developing baby. In the mother, it can lead to issues like bleeding or even miscarriage, or pregnancy-induced hypertension, or even preterm labor. In the baby, it can lead to mental retardation. The second important fact is to remember that the unborn baby, that's the developing fetus inside the mother's womb, does not have its own thyroid gland or its own thyroid hormones for the first half of pregnancy, almost till 7 months. And in this first 7 months of pregnancy, the baby is completely dependent on the mother's thyroid hormones. Hence, it is very important to understand that the mother's thyroid hormone levels should be normal throughout pregnancy, especially in the first half. Now, there could be two types of scenarios where we see thyroid disorders in pregnant women. The first is a lady who has a thyroid issue and now gets pregnant. And the second is a lady who has no thyroid issues, is pregnant, and a routine blood test of pregnancy show a thyroid dysfunction. So it is important to understand that for women who have any thyroid disorders, they need to maintain their levels in the normal range before they get pregnant. So for hypothyroid women who are on thyroxine, we instruct them that as soon as their pregnancy is confirmed, do step up the doses a little bit and get in touch with your doctor immediately. They will need to be followed up every 1 or 2 months with the blood test to ensure that the medications are in the right dose. Similarly, for hyperthyroid women, it's very important that their thyroid levels are maintained in the normal zone before they get pregnant, and as soon as they get pregnant, they need to get in touch with their doctor. They need to be monitored every month with blood tests to ensure that the doses of medications are kept in the right range and their blood levels are maintained in the right range. The second category which we talked about are pregnant women who didn't have any thyroid issues, but they detected for the first time in pregnancy. And this is a very common scene we come across. So it is recommended that in India, all women who get pregnant and are above the age of 30, or who have some risk factors like a previous miscarriage or a family history of thyroid dysfunction, they need to be tested for thyroid hormones at their first visit to the gynecologist. It's their first ANC visit, because timely detection, or rather early detection, treating in time appropriately with the right amount of medications, maintaining the hormone levels in the normal zone, will ensure a healthy pregnancy and a healthy baby. Thank you.